Good day, CPE residents. This is Chaplain Jessup, and I wanted to share with you a few thoughts as we move toward our journey in CPE. CPE can be based on Proverbs 15:22, which says, "Without consultation, plans are frustrated, but with many counselors they succeed." Or the whole idea of Psalm 23, "Yea, though I walk through the valley, thou art with me." Or Galatians 6:2, to bear one another's burdens. The core purpose of the First Health of the Carolinas is to care for people. This includes spiritual care. The core values of First Health include focus on quality and excellence, integrity, respect for the individual, service for others, and teamwork. The 2020 vision for the First Health of the Carolinas is working together, first in quality and first in health. The Department of Pastoral Care's mission statement is as the following. As a member of the healing team, the Department of Pastoral Care supports the First Health purpose to care for people by tending to matters of the heart and spirit as necessary resources for healing in order to facilitate optimal patient health or experience, to provide pastoral care to all patients upon the identification of need. The department core values are focused listener, interdisciplinary pastoral care, relational, spiritual companionship, and training for excellence. In the time remaining in this segment, I want to briefly introduce you to some of the history behind CPE. 80 plus years of learning through supervised encounter with living human documents. The early development of CPE came from what was known as the Emmanuel movement. The leader of the Emmanuel movement believed that the art of ministering to the sick cannot be acquired by reading or listening to didactic lectures, as had been traditionally taught in seminary. These leaders believed that it could only be learned through actual contact and visitation with the sick. Let me mention some of the key leaders in the early history of CPE. Dr. Richard Cabot was one of these key leaders. He was a physician and professor at Harvard in Boston. He had a desire to bring theology to the bedside, and he perceived the problem of seminary training ministers to be scholars without teaching them how to relate their theological knowledge to the care of parishioners. And then he essentially developed and taught what we use today, which is called the clinical case method. Trainees would study case studies and give feedback to each other. Dr. Cabot wanted trainees to understand the complexities of an individual case, and that cases carried a uniqueness to them. And thus he created an emphasis upon what has become known as spiritual pain diagnosis or spiritual pain assessment. Another key leader was Anton Boyson, was one of Cabot's students initially, was known to have suffered from psychosis occasionally, However, through it all, he became a chaplain at a mental health hospital there in around Boston. And as he developed as a chaplain, he recruited theological students to help. In the summer of 1925, he felt a need for clergy professionals to have experience with living human documents. Keep this word in mind as you journey with CPE, because that is a key kind of phrase throughout the history of CPE. Some of the folks in this early group were pastors. One was a physician. Her name was Helen Flanders Dunbar, a psychiatrist who became essentially a leader in the early CPE movement. Through the early years, there was some conflict that arose between the Cabot and some of these early leaders. Dr. Dunbar was a leader in the early movement. She formed in January 1921, 1930, the Council for Clinical Training of Seminary Students, and moved her headquarters to New York from Boston. She majored in and recognized the function of symbolism. And that symbolism within, she recognized as a commonality between both religion and psychiatry. And thus this combination led her to believe in what she called insight symbolism, this combination of religion and psychiatry. Her findings led to the usage in her clinical training of seminarians, the usage of psychoanalytical psychotherapy. And thus, as a conflict arose among the different CPE leaders, it led to an alienation of several of the key leaders, such as Boyson, with the group, the New York versus the Boston group. And essentially what you had was two powerful training groups for seminarians. The New York group, which was led by Anton Boyson and Dr. Dunbar, focused heavily upon verbatims in psychology. Primary focus was on the perspective of depth psychological meaning. Additional focus in the New York group focused upon the unconscious process of personality development and behavior as understood by psychoanalytical psychotherapy. The emotional or the experiential sense of self was primary to this New York group. The New England group focused on conceptual thinking, with concepts being primarily theological ones. The emotional and experiential side was also recognized, but the conceptual or professional practice was primary for this group. Goal was finding practical application in pastoral care ministry. One of the key leaders in this group was Dr. Dix, Russell Dix. He wanted to train persons on how to deal with individuals in the hospital room. And thus he formally incorporated training of seminarians in January 28, 1944 as the Institute of Pastoral Care. Over the years, with these two groups being dominant in the training of CPE, several efforts were made at reconciliation. Over the years, these groups came together. One in 1957, which was the Southern Baptist Convention, formed its own training for CPE. And again, you have these two main groups, one focusing on being primarily concerned with psychology, and the other primarily concerned with theology, although I know you can't see that on your screen, but that's the last line. The other was so essentially what we have here is a division between the head versus the heart. Clinical training conflict develops around these two critical issues. How much psychological information do we need to understand the human condition, the head, or theory? Or how much pastoral counseling or sensitive talk therapy or confession does one use, the heart or intuition? Anyway, this led essentially to the formation of the Association of Clinical Pastoral Education in 1967. In the mid-80s, unrest developed among some within a CPE. A subgroup came together in 1991 to form a new accrediting and certifying body known as CPSP, the College of Pastoral Supervision and Psychotherapy, Inc. These individuals felt that the current movement had lost some of its original vision of voicing and serving the living human document, sought a recovery of the soul in clinical training through an integration of theology and behavioral science knowledge, theory, and experience as the guiding principles for clinical pastoral education training. And thus there are many certifying bodies and organizations throughout our, at least here in the United States and internationally. So First Health is accredited by CPSP Inc. We have a local chapter here. It meets every other month here at First Health Moore Regional. There are many other pastoral care and counseling groups that you may be familiar with, or at least I want to introduce you to. So, and you can begin to explore these. CPSP is a member of COMAS, the Commission on Ministries in Specialized Setting, the largest umbrella of pastoral care and theological professional groups in the world. And much of our life in CPE is based on our covenant, which essentially is a guiding principle for work in the life of the chapter. And so the covenant says, we, the CPSP members, see ourselves as spiritual pilgrims seeking a truly collegial professional community. Our calling and commitments are therefore first and last theological. We covenant to address one another and to be addressed by one another in a profound theological sense. I won't belabor this. You can begin to look at this covenant on the website. So there you have just a little bit about our work here at the hospital and the history of CPE. If you have any questions, feel free to email me about it. May the Lord be with you.